welcome back. Or if you're new here, welcome to the channel where we talk predominantly about topics related to mental health and where I strive to inform you all about various topics related to mental health. So I've got all my information gathered up for this new video where I will be continuing to talk about ADHD. And there is a lot of it going to be discussed in this video. So if you see me not looking at the camera, it is because I'm looking at my notes to make sure I don't forget something. So this is the follow-up video to my initial video about symptoms of ADHD. So today we are going to dive deeper into the facts of ADHD. The symptoms related to ADHD can be broken down into two types of behavior-related problems. One of these is inattentiveness, and that basically means that you have a difficulty concentrating and focusing. And the other would be hyperactivity and impulsiveness. Now, many people who are diagnosed with ADHD have problems that can fall into both of these categories. But this is not always the cause because each situation is different. For example, 2 to 3 in 10 people with this condition have problems associated with concentrating and focusing, but not problems with hyperactivity or impulsive behavior. This form of ADHD is better known as attention deficit disorder or ADD. ADD can sometimes go without being noticed because the symptoms are not as obvious. As it relates to girls being diagnosed with ADHD, they are more likely to show signs of inattentiveness only, and they are less likely to show symptoms such as disruptive behavior, which makes symptoms of ADHD more obvious. This also means that girls with ADHD may not be diagnosed in a timely manner or at all. Symptoms of ADHD in children and teens are well defined and usually noticeable before the age of 6, and usually occur in more than one situation, such as, for example, at home or school. Children can have symptoms of both inattentiveness and hyperactivity and impulsiveness, or they could have possible symptoms of just one of the listed types of behavior. Inattentiveness is defined as difficulty concentrating and focusing. The most significant signs of inattentiveness are as follows: having a short attention span and being easily distracted, making careless mistakes, for example, as in schoolwork, appearing to be forgetful or misplacing things regularly, being unable to stick to tasks that are considered to be tedious or time-consuming, appearing to be unable to listen or carry out instructions, constantly changing activities or tasks, having difficulty with organization and completion of tasks, hyperactivity and impulsiveness. The main signs of hyperactivity and impulsiveness are as follows: being unable to sit still, especially in calm or quiet surroundings, constantly fidgeting, being unable to concentrate on tasks, excessive physical movement, excessive talking, being unable to wait their turn, acting without thinking, interrupting conversations, little or no sense of danger. These symptoms can cause significant problems in a child's life, such as underachievement at school, poor social interaction with peers and adults, and problems with discipline. Related condition in children and teens with ADHD. Although this is not always the case, some children can also have signs of other problems or conditions alongside their ADHD, such as anxiety disorder, which causes children to worry and be nervous much of the time. It may also lead to physical manifestation of physical symptoms such as rapid heartbeat, sweating, and dizziness. Oppositional defiant disorder, or ODD, this is defined by negative and disruptive behavior, particularly towards authority figures such as either parents or teachers. Conduct disorder. This often involves a tendency towards highly antisocial behavior, such as stealing, fighting, vandalism, and harming either people or animals. Depression means that they are in low spirits or in a state of despair. Symptoms of depression in children often manifest themselves as sadness or a low mood that does not go away, being irritable or grumpy all the time, not being interested in things they used to enjoy, feeling tired and exhausted a lot of the time, and more often than not, if children are depressed, they may also have trouble sleeping or sleep more than usual, not be able to concentrate, interact less with friends and family, be indecisive, not have much confidence in themselves, eat less than usual, or they may overindulge. As relating to adults, the symptoms of ADHD are more difficult to define. This is predominantly due to a lack of research into adults with this disorder. Being as ADHD is a developmental disorder, it is believed that it cannot develop in adults without it first making an appearance during childhood. But symptoms of ADHD in children and teens often continue into adulthood. The way in which attentiveness, hyperactivity, and impulsiveness affect adults can be totally different from the way they affect children. As an example, hyperactivity tends to decrease in adults, while the inattentiveness tends to remain as the pressures of adult life increase. Adult symptoms of ADHD tend to be more subtle versus those in childhood symptoms. Some specialists suggest that the following as a list of symptoms associated with ADHD in adults: carelessness and lack of attention to detail, continually starting new tasks before finishing old ones, inability to focus or prioritize, continually losing or misplacing things, forgetfulness, restlessness and edginess, difficulty keeping quiet and speaking out of turn, blurting out responses and often interrupting others, mood swings, irritability and a quick temper, inability to deal with stress, extreme impatience, taking risks in activities often with little or no regard for personal safety or for the safety of others. For example, this would imply driving dangerously. As with ADHD in children and teens, ADHD in adults can occur with several related problems or conditions. One of the most common is depression. Other conditions that adults may have or that could occur alongside ADHD are as follows. Personality disorders. This is a condition in which an individual differs significantly from average people in terms of the way they think, perceive, feel, or relate to others. Bipolar disorder. This is a condition affecting your mood, which can swing from one extreme to another. Obsessive compulsive disorder is also known as OCD for short. It is a condition that causes obsessive thoughts and compulsive behavior. The behavioral problems associated with ADHD can also cause problems such as difficulties with relationships and social interaction. This has been another video by Chris, mental health advocate. And I hope this video helps people out there who have questions about ADHD and its symptoms. And remember, here at the channel, this is a safe place that you can go to talk about how you're feeling, or if you have questions, you can leave them in the comments section, or you can DM me over at Instagram, and I will respond as soon as I can. Until the next video, this has been Chris, Mental Health Advocate, and I'll catch you on the flip side. Also, I will be doing another video after this one to finish out this series on ADHD, so keep an eye out for it. I will drop a video on YouTube as I get closer to release of the video to close out the series on ADHD. Also, leave a comment on what mental health topic you would like to have me cover next. Thank you.